Hello, I'm Sabri Adel-Sadi from the Center for Research and Education on Violence Against Women and Children at Western University. On behalf of the team, welcome to the Knowledge Hub Presents series. This series brings together a wealth of information on trauma and violence-informed research and practice developed by the trauma-informed community of practice members as part of their work on preventing and addressing family violence. To know more, please visit our website. I would like to acknowledge that our work takes place on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenape, and Chinoochton nations. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. We perform this land acknowledgement to counter the doctrine of discovery and recognize Indigenous lands and sovereignty. With this, we respect the long-standing relationships that Indigenous nations have to this land, as they are the original caretakers. We acknowledge historical and ongoing injustices that Indigenous peoples, First Nations, Métis, and Inuit endure in Canada. We accept responsibility as a public institution to contribute toward revealing and correcting miseducation, as well as renewing respectful relationships with Indigenous communities through our teaching, research, and community service. Because the Knowledge Hub is based on trauma and violence-informed health promotion, we also recognize the intergenerational trauma and the resilience that resulted from the colonial agenda and genocidal projects of residential schools, day schools, and Indian hospitals. We are committed to centering these experiences throughout our work. We are pleased to welcome today Marie-Ève Grisé-Bolduc, who will talk to us about ASTRA, a training on trauma-informed approaches in the perinatal period. Marie-Ève Grisé-Bolduc is a research officer with the STEP project supporting transition and engagement in parenthood of the Centre d'études interdisciplinaires sur le développement de l'enfant et de la famille at the University of Quebec in Trois-Rivières, led by Professor Nicolas Barthelot. She is also a lecturer in psychoeducation and a guest speaker in Canada and France. She is the author of the best-selling 10 Questions on Complex Trauma in Children and Adolescents and a professional member or collaborator at various research centers, namely the Canadian Consortium on Child and Youth Trauma, the Centre de Recherche Interdisciplinaire sur les problèmes conjugaux et les agressions sexuelles, and the Centre de Recherche sur l'enfance et la famille. With that, I will give the floor to Marie-Ève, and we will be back during the question and answer period. Thank you, Sabri. Thanks to the team. Hello and welcome. Thanks for being here today. 170 people, I think that's amazing. I wasn't expecting that. Welcome. My team and I are very proud to be here with you today to speak about one of the projects that we've been working on over the last few years and that was recently launched. This project is the creation of a training program on ASTRA, which is an acronym that means Trauma-Informed Care in the Perinatal Period. This is a project that was funded by the Public Health Agency of Canada and was realized with Professor Nicolas Berthelot. It was a grant obtained by Professor Nicolas Berthelot and is supported by the Canada Research Chair in Developmental Trauma. Okay, so here's an overview of the presentation. So we'll be together for a very short period today, so I'll quickly introduce the team that worked on the project. I'll describe what the training is, the ASTRA training, so what are its features, target audience, general objectives. I'll also talk about the educational methods that are used, and I'll give you an overview of the practice support materials that were developed during the training development. I'll also speak about the ongoing study of our social media and of the next steps for ASTRA. So the content was developed by myself and by Dr. Nicolas Berthelot, who is a full professor at the University of Quebec in Trois-Rivières. And of course, we made sure that it was quality content, it was varied, and it was concrete. That was important, and based on recent evidence. We also want to state that, to our knowledge, ASTRA is the only training offered in French that is free. And it's asynchronous, available online on the topic of trauma-informed care in the perinatal period. So basically, it's a truly unique and original product in the field. And it's also important to note that the training is currently accessible in French, but will be translated in English over the next few months. So I'll be sharing more details with you a little bit later in this presentation. So I really wanted to showcase the team that's behind the project. So there's a full team, technical people, scientific revision. So we have 3 scientific reviewers who are from clinical psychology, perinatal nursing, and specialized neonatology services. So we're quite lucky to have been able to count on such a team to be able to revise the entire content that was prepared for this training. So the ASTRA training, as I was stating earlier, is offered online. It's asynchronous, meaning that you can follow it at your own pace, whether you're home, at work, or in an academic context. And there's no time limit to complete it, but we still recommend that you put a little bit of time in your schedule to be able to complete it. It lasts about 4 hours, more or less. If we include the reflexive exercises that we propose during the training, well, these exercises are optional. So I would say there's probably about 3 hours of contents and about 30 to 60 minutes for the reflexive exercises that aren't mandatory. And as I previously said, this training is entirely free. If you need a certification for your ongoing education units, I think there's a fee of $25 plus tax to get your CEU, so it's affordable. And it was launched 2 months ago now. And we can tell you that as of last week, more than 200 people had started the training, and we have almost 500 people who've been curious about it, who've created an account so that they could go see what this training is all about. So I would say that up to date, is pretty successful. So the target audience for the ASTRA training is as followed. It's for everyone who's offering care and services during the perinatal period. So a key takeaway here is that you don't need to be a specialist in trauma treatment, or we don't need to be working exclusively with people who've experienced trauma to benefit from the ASTRA training. Because trauma-informed approaches, which I'll be defining a little bit later, well, basically, it means that there are several people who benefit from care and services regardless of their traumas, be they interpersonal during childhood, their teenage years, or other that haven't been dealt with. So if you provide care and services to this population, it's likely that the people who will benefit from these services have lived such experiences. So the ASTRA training is relevant for everyone. And we put an emphasis on pregnancy and delivery, but we also focus somewhat on the conception period and a little bit on parenthood, but we really don't focus on these. But the contents can be easily transferred to that period of time. So in the slide here, you have a list. It's non-exhaustive of people who work in perinatal care, who are targeted by the training, who mostly come from the field of health services, but could also come from social services. For example, if you offer such services to expecting parents. So, what are the premises for the ASTRA training? Well, as I've said earlier, a lot of people who are receiving services have experienced trauma in their childhood and youth. So, a study that we made revealed that 1/3 of expecting parents have been exposed to at least one childhood trauma during their childhood or during their teenage years, and this could take on various forms of maltreatment. And we know that these traumas can have consequences on people experiencing perinatal care and on the relationship with the service providers and the care providers. For example, studies have noted that parents are dissatisfied, expecting parents are dissatisfied when it comes to the perinatal care they get. And parents who have had childhood trauma are even more dissatisfied. They are also sometimes afraid of their care suppliers during the perinatal period. They don't trust the service providers. They also have trouble communicating their needs. So, in that context, we think it's important to reflect on the care and the services while taking into account these realities so that we can improve the experience and the trajectory of these expecting parents during the perinatal period. And we also want to make sure we can help them improve their mental and psychological health. And let's note that traumas aren't always revealed. So, trauma-informed approaches try to take universal precautions so that we don't so that we can resist re-traumatizing expecting parents. So I'm going to talk about trauma-informed approaches quite briefly because we really don't have a lot of time together. So to summarize, the ASTRA training details everything. So the trauma-informed approaches want to make sure that all of social institutions, as well as professionals, workers, are preoccupied by psychological traumas when they're developing their policies, their procedures, their organizational methods, their service offerings, and when they provide care and services in their practice. So, the objective of trauma-informed approaches is to organize all services at several levels, from preventive to curative. And as I was saying earlier, trauma affects a large portion of the population. But since traumas aren't always revealed by those who have experienced them, well, trauma-informed approaches don't require knowledge of the presence or absence of a person's trauma history to adapt our practices accordingly and apply them to everyone, whether they have or not experienced trauma. And trauma-informed approaches can be applied by all forms of services, whether they be specialized or not, and by all types of staff, be they clinical or non-clinical. So, service providers and care providers don't need to be working in mental health or be specialists in trauma treatment to implement these trauma-informed approaches in their practice. So, here are three major statements on trauma-informed approaches. Firstly, they encourage and promote an organizational culture change process through the 4 criteria and 6 principles of trauma-informed approaches that are detailed in the training that I won't be presenting today, but that are quite detailed in the ASTRA training. They're described in theory, but they also are described concretely to enable you to apply them in your practice. So these criteria and these principles organize the environment, the interactions within a system and a practice. And their objective is to promote a safety culture, a physical safety, psychological safety, emotional safety, and to promote an empowerment culture. And then trauma-informed approaches aim to better understand trauma, its presentation, and its prevalence. because these trauma-informed approaches are based on an understanding of the origins, of the prevalence, and of the possible consequences of trauma. And this knowledge is then used and integrated by all professionals and members of the staff, be they clinical or not clinical, of a system or organization to influence the delivery of care and services. So this knowledge allows people to understand that the behaviors or relational methods used by some expecting parents may find their origins in traumatic experiences. And this enables professionals to really foster interactions within a compassionate and caring setting. It's also a respectful setting. And lastly, trauma-informed approaches allow us to neutralize the environment. So we apply the principles of trauma-informed approaches as well as the criteria, and this helps us neutralize the environment of elements that could lead to the re-traumatization of expecting parents. So I'll skip over this slide because we don't have a lot of time together. I want to talk about the general objectives of the ASTRA training. So firstly, it's about acquiring knowledge about childhood traumas and their consequences. Then, we want to understand how childhood traumas can affect the experience of the perinatal period. We also want to bring people to acquire knowledge of the principles and foundations of trauma-informed approaches and understand the rationale behind the implementation of these in perinatal care and services settings. And then, using several reflexive exercises, we want to bring people to reflect on ways in which care and services offered in the perinatal period can be adapted to take into account the possible childhood traumas experienced by adults expecting a child. And lastly, we wish to bring people to know how to deal with traumatic reactions and revelations of trauma. So we have a full module. We have 7 modules in total. And there's a module that talks about how to listen and welcome revelations of trauma from people that we are providing services to. We also want to know how to prevent re-traumatization during care and services delivery. So the ASTRA training is not limited to raising awareness and to educating. It also wishes to provide concrete strategies that can be applied in practice so that we're better equipped to provide compassionate and respectful care. And overall, that will help us contributing to building a humane and equitable system. So there are several educational methods that are used during the training. I don't have time to give you a small demo, but this is more or less what it looks like. So, once you access the training platform online, there are 7 modules, and within each module, the content is presented in various ways. So it could be video clips, clinical vignettes, and these are accompanied by exercises, which are optional. There are also various reflective exercises, which help to apply what's learned during the training and apply to the practice. There are some readings. We've also tried to make everything more attractive visually. So there are several graphics. We also present some metaphors or some analogies so that we can present the content in different ways, not just theory-based, but also we want to make sure we touch people's emotions and imagination so that they can find different ways of learning. There are also a few downloadable tools that we've created that are available in the training. So these are tools and memory aids or checklists. And I think we can see them on the next slide. So we've created 9 downloadable files that support practice. So these are practice support materials. I think you'll appreciate these. So I show them quickly. So firstly, there's a memory aid on differentiating between approaches that are trauma-informed and trauma-centered. And that support material has fiches that are for the service providers, but also for expecting parents. So in the bottom left corner, on the title page of each one, it states who the tool is for. So we have a tool that says how to deal with people who are revealing or reacting in a traumatic way. We also have something on resisting re-traumatization. These are reflective exercises. So this could be done individually, but it can also be a tool that accompanies us. For example, when we have team reflection activities. We also propose a support plan to accompany people who are expecting a child who could be confronted with triggers, traumatic triggers. We also have a memory aid on the 4 criteria of the trauma-informed practices. So I see that on your I see that on your bulletin board or somewhere else. And then we also have a downloadable file on shared decision making and on the 6 principles of trauma-informed approaches. So here at the bottom, you see that there's 2 of the same. So these are shared decision making. It talks about empowerment. It talks about trauma-informed practices. And lastly, we have the walkthrough exercise. So this is a way that aims to apply the principle of safety of trauma-informed care. And that's presented in Module 6 of the ASTRA training. It helps people reflect on the implementation of actions to foster a welcoming, inviting, and warm environment for patients, as well as care and service providers. Stressors are minimized to the greatest extent possible. So I see the time. So I'm going to take another couple minutes just to finish up, and then I'll turn over to you. So my contact info is in the last slide. So if you have questions that we can't answer today, please write to me and I'll be more than happy to reply. So as I was saying earlier, we were funded by the Public Health Agency of Canada to create this training. But we were also financed to assess the effects or the impacts of this training. So people who register to the training and who work with expecting parents are invited to participate in a study. It's not mandatory. So if you refuse to participate, there's no impact on your participation to the training. And you can obviously withdraw from the study at any time. So here we want to assess the impacts of the ASTRA training on professional practices, on the professionals' knowledge, and on their well-being. We also want to explore the strengths and the challenges that professionals and organizations can face when they apply the criteria and principles of trauma-informed approaches. And lastly, we want to evaluate the satisfaction of users with the content and learning methods. So how is this done? Well, we use various questionnaires that are administered online at various times. So just before the training, during the training, and right after the training, and then 2 months after the training. We contact you again with 3 online questionnaires that take about 15 minutes. So I've put the times here so that you can see what to expect. We've also created social media channels, one on Facebook, Instagram, and LinkedIn. So I really invite you to subscribe to our social medias because we share exclusive contents. It's free. It could be video, it's mostly video clips. We've created 26 video clips, additional video clips that aren't part of the training, that are only on the social media networks. And it's really to help people maintain what they've learned, preserve the knowledge that they've gained from the training. And they're very short, very accessible. And even if you don't take part into the training, well, it's free content, so subscribe. It's fun because you don't need to invest a lot of time or commitment to it. Okay, so to conclude, what's next? Well, a knowledge transfer on social media. So up to date, we have 26 video clips. We still have 20 to come about. We're going to be doing the ASTRA promotion in various ways. And as I was stating earlier, the training will be translated into English, and we hope that it'll be ready for fall 2025. So you can click on the link bit.ly that's at the bottom of the slide. You can leave your email address, and that way, once the training is available in English, we'll send you a small email and a short email to tell you that it's now available. And obviously, we want to keep collecting data. There's an ongoing study that will be published, and we'll be presenting the results for that study at some point. So there you go. Thank you so much for being here. It's really appreciated. I'm so pleased to see that you're interested in the ASTRA training. I know that we don't have a lot of time left for questions, but as I've told you, you see my email here. There's also the social media where you can reach us, and I'll be happy to answer your questions. Thank you so much. Well, thank you to you, and thanks to the team for creating this training, Marie-Ève. We don't have a lot of time left, and I saw that Nicolas has answered a lot of the questions already in the Q&A. But a question that might be important is as follows. What would be the most important learnings you've done while developing this training that you can share with us? So our learnings? Okay, well, I'd like to say that we started collecting some preliminary data since the training's been online for 2 months. Some people have started taking part in the study. And with the answers we've gotten up to date, we're able to see that it really satisfies the need. So the majority of people who've registered to the training have said they had not a lot of knowledge on PTSD, on complex PTSD. And some say that they have some pretty good knowledge about trauma-informed practices, but when we ask them questions, do you know the 6 principles of the trauma-informed approaches, the 4 criteria? Well, then the level of knowledge goes down in the majority of people. So I think this really speaks to the relevance of this training. And up to date, we've had some great feedback. People find it's concrete, it's accessible, it's really close to their practice. So I think that speaks to the relevance of the training. So we're quite happy with it. Thank you very much. So that's all the time we have for today. Before we leave, can we have the slides up, please? So I want to announce the official dates for the Knowledge Hub conference that will be held in Toronto on October 1st and 2nd. Registration links, as well as all information about the conference, will be shared on the chat and are available on our website. Please feel free to contact us if you have any questions. Thank you to everyone who joined us today and to all our participants. Thank you to the interpreter, Sylvie. See you soon.